Imagine a scenario where something as basic as your daily life habits could be the secret cause of a significant health problem. This situation is true for your kidneys' health. These tiny, powerful organs are the unnoticed champions inside your body, continuously purifying and filtering. But what if I tell you that your daily routines, which appear harmless, could be putting your kidneys at risk secretly? Hello and welcome to our channel. Today, I am revealing 7 common habits that might be quietly damaging your kidneys. This exploration is not only enlightening, but also an essential move to protect a very important function of your body. And before we proceed further, please note that the information provided on this channel is for informational and educational purposes only, and should not be treated as medical advice, diagnosis, or treatment. So, are you prepared to learn about these habits and the way to improve your kidney health? Make sure to give us a thumbs up as we start. Number 1. Overusing painkillers. Do you sometimes take a painkiller to ease a headache fast or make joint pain go away? Actually, many people do this. But there is something maybe you don't know. If you use painkillers frequently, it might actually cause more problem than good. And it can be really bad for your kidneys. I'm talking about the drugs that are called non-steroidal anti-inflammatory drugs, or NSAIDs. These include common medicines such as ibuprofen and naproxen that many people keep in their medicine cabinets. Now, NSAIDs definitely work well for easing pain and lessening swelling, but there is a downside as well. If people use them too much, particularly those who already have kidney problems, lack water in their body, or diseases such as diabetes and high blood pressure, NSAIDs can greatly damage how the kidneys work. Number 2. Excessive alcohol consumption. Alcohol consumption is something that lots of people enjoy. Having wine with their meal, drinking a beer when it's hot outside, or enjoying mixed drinks with friends. But are you aware that drinking too much might be damaging your kidneys without you realizing it? Research has found that if a person drinks heavily on a regular basis, which means they drink more than 4 alcoholic beverages every day, this habit increases their chance of getting chronic kidney disease by 2 times. But what exactly is too much? The guidelines are clearer than you might think. It is advised that men should not have more than 2 alcoholic beverages daily, while women should limit themselves to only 1. This is not to ruin the enjoyment, it's to protect your diligently working kidneys. Drinking alcohol may raise blood pressure and change how your kidneys work, which makes it more difficult for them to clean your blood properly. Number 3. Smoking cigarettes. We all know about the cautions around smoking, but how it affects kidney health gets less attention compared to other known risks. Smoking does not only damage your lungs, it also presents a significant danger for kidney disease. Every time you inhale smoke, the blood that goes to important body parts like the kidneys gets decreased, which makes them work improperly. Additionally, smoking makes it more likely for a person to get renal cell carcinoma, which is a kind of cancer that affects the kidneys. When you smoke, the substances in cigarettes make your blood vessels become smaller. This leads to less blood flow and makes kidney function decline faster. This harm can be slow and without notice, which makes it more risky. So, if you smoke, deciding to stop might be the best choice for the health of your kidneys. Number 4. High sodium diet. Now, imagine a table full of foods that you like very much. Maybe there is pizza, canned or processed foods, or chips to eat. These foods are delicious, right? But the problem is that they contain a lot of sodium. This can be bad for your kidneys, and sometimes you do not see it in your diet. High salt in your diet makes your blood pressure increase. This can be a risk for long-lasting kidney disease. Kidneys never stop working to remove the extra sodium from your blood, and too much salt make them work harder for you and might become a reason for the damage. So, how can you relish tasty food without consuming too much salt? Here are some useful suggestions. Start checking nutrition labels for sodium content. Home-cooked meals allow better control over your salt intake. Try using different herbs and spices to add taste to your meals instead of always using salt. Number 5. Dehydration and not drinking enough water. Water is very important for the kidneys to work properly, as it helps to remove harmful substances and waste from your body. But if you do not drink sufficient water, these harmful materials may build up, which can cause too much pressure on your kidneys. It is usually recommended to drink around 6 to 8 glasses of water daily. But this might change based on how you live and your health condition. For example, people who exercise a lot or stay in warm places may require additional water. You might consider having a water bottle close by during your day to remember to drink enough water. If you think plain regular water is too dull, perhaps try adding something extra for flavor. Putting slices of fruits, such as lemon, lime, mint, or cucumbers into water can give it an extra zing. It can also make drinking water more pleasurable. Number 6, a high-protein diet. Many people like eating a diet rich in protein because it helps with muscle building and weight loss, but we must consider its impact on the kidneys. The fact is that protein is a very important nutrient, but if you have too much of it, especially from animals, it can make your kidneys work too hard. Why is this the case? When a person digests too much protein, their blood becomes very acidic, and this situation might damage the kidneys. Now, you don't have to stop eating protein in your food. It's more about keeping a balance. Adding proteins from plants such as lentils, beans, and tofu can give you the protein your body needs and be easier on your kidneys. Number 7, not sleeping enough. You may find it shocking, but how well and long you sleep affects your kidney health too. Kidneys function on a day-night cycle that controls their filtration activity during different times. But when you don't get enough sleep, this rhythm is disturbed, and it may cause blood pressure to go up and put more stress on the kidneys. So, what can you do? Strive for at least 7 to 8 hours of quality sleep each night. Establish a night ritual that helps you unwind, such as engaging in reading or meditation activities, and maintain regular sleeping hours. Proper sleep is not only about waking up refreshed, it's also crucial for allowing your kidneys sufficient time to perform their vital functions. As we finish going over these 7 habits, keep in mind that looking after your kidneys means looking after your whole health, and little actions can result in large differences. So, if this video was useful to you, please like it and remember to subscribe to our channel for more tips about health. And we'll see you in the next video.